The presentation that I did for the AAD virtual meeting was recorded back in early May. And so those two particular studies were case reports that had come out just around that time. And since then, more case reports even have come out. The thing that I learned from these case reports, and also has been shown now with the larger studies from Spain and through the international registry as well as the AAD's registry, is that there are manifestations on the skin that may or may not be related to COVID-19, but are in patients diagnosed with COVID-19, sometimes with serologic testing or symptoms or with nasopharyngeal swab testing. And the patterns can be quite variable. So sometimes it's, as from those two case reports in early May, for example, it can be sort of a very strange digitate dermatosis-like presentation on the skin. It might be sort of a diffuse purpuric look with a macular-papular sort of overlying look as well. And so just there's quite a variability, and it's unclear as of yet if there's any true sort of link on a microscopic basis, for example, because not all of these patients have been biopsied. So a lot that we don't know, but I think as more papers have come out since May, what does seem to be true is definitely the acroperiotic lesions do look like perniosis under the microscope. We did do a small study of acroperiotic lesions that we saw in sort of late May, early June here in Connecticut, and would be a atypical time for idiopathic perniosis since the weather has been typical summer weather, quite warm here. And interestingly, we could not detect any of the virus by immunohistochemical staining. Meanwhile, another British Journal of Derm paper that was recent looked at 7 pediatric patients. In our series, the patients were adults. So I don't know if there is a difference, I think, between the way children and adults seem to respond overall to the virus. So it may be the same thing is going on between my series as well as this other series, where they looked at 7 pediatric patients. This was published in the British Journal of Dermatology, and they did do immunohistochemical staining against the spike protein of SARS-CoV-2. And they showed positive staining within endothelial cells and eccrine glands. And they had 1 case with electron microscopy, and showing that there was a particle that seemed to be, okay for being the SARS-CoV-2 virus. So ultimately, I think it still remains unclear exactly the relationship between perniotic lesions. That immunohistochemical study in the British Journal would suggest that there's direct infection of the skin in these perniotic lesions with the virus. Our study didn't detect it, so it's unclear. Both studies were a small number of patients. More just needs to be studied on this subject.